Hello, everyone. I'm just waiting a couple of minutes as I see the participants coming in. So just give us another minute or so. So while we're waiting a second, we're expecting about 115 participants tonight. So I'm watching the numbers go up. We're a little over halfway there. So I'll just give it 1 or 2 more minutes and I'll get started. Okay, well, participants are still joining, but we only have an hour and we can run over a little bit, but I don't want to keep people waiting. So good evening and thank you for being here. Welcome to TPC's first big Zoom webinar. We're hoping everything goes smoothly tonight. My name is Barbara Gaskin and I'm the president of the Philanthropy Connection. And my co-host tonight is fellow board member Bridget Dunn. So I know we have a number of guests tonight, so I'd like to spend just a few minutes telling you about who the Philanthropy Connection is. We are a women's collective giving organization of women, diverse group of women from around the greater Boston area. This year we have 285 members. And about 27% of our members are under 35. So in addition to grant making, our mission is to educate women about effective philanthropy. And throughout the year, we hold a number of educational events. And now through the miracles of Zoom, we will be able to bring those events to even more members next year, we hope, and offer some new programs as a result. So over the last 7 years, we've awarded over $1.3 million to 42 nonprofits that have revenues under $2 million. These are organizations that are working on the front lines that often find it difficult to get the funding that the larger nonprofits get. So this month, on May 28th, we will be awarding another $250,000 to 10 nonprofits. And so I invite all of you to bring your guests, join us again for another Zoom on May 28th and learn more about who TPC is. And together, we hope we can give out even more grants next year. So to sign up for that is just like you did for this. It's on our website and we hope you'll join us. But tonight is not about us. Today is Giving Tuesday. And as part of that initiative, we wanted to listen to the stories and challenges faced by our grantees during this unprecedented crisis and learn what we can do through our donations, our time, and our resources to assist them as they provide so much needed services to people throughout the Boston area. So tonight, you're going to hear from 8 organizations, and they're addressing issues such as increasing food insecurity, homelessness within our young adult populations, unsafe work conditions where workers are being made to work without personal protective equipment, the elderly who are even more isolated now than ever, adoption needs, immigration services and rights, and women at risk facing even more challenges than ever. So we could spend hours with each of these incredible organizations. But tonight, we want to give you a glimpse into their work and introduce you to them and encourage you to follow up with them directly and learn more. So the format tonight is I will introduce each grantee, and they will speak for about 4 minutes about their organization and the challenges they're currently facing. And at the end, we will have about 15 minutes for questions. If you'd like to ask a question, please use the Q&A box at the bottom of your screen. We likely will not get to all the questions, but following this presentation, you'll receive an email with links and contacts for all of these fantastic organizations so that you can contact them directly. So first, we will hear from 2 organizations that serve our young adult populations. And I'd like to introduce Judy King from the Wiley Network, who will start off.
Good evening, everybody. Thank you so much, Barbara, and thank you to TPC for assembling this event tonight. We've all learned so much about working together virtually, and thank you to everybody who's attending. Now for my Wiley update. As many of you know, we work with college students who are navigating college without a safety net. For Wiley, this is the moment of our mission. For the last 5 years, I've tried to explain to people what it means to be a Wiley Scholar. I'd say, if a Wiley Scholar gets the measles and is asked to leave school for a few weeks, they would have no safe place to go. So you know where I'm headed with this. In mid to late March, this did not happen to one Wiley Scholar. This happened to all 55 Wiley Scholars. It was an unfortunate proof of concept. So we assessed. We planned for the worst and we hoped for the best. And then we pivoted. What was a very personal, high-touch program where we met with college students on their campuses, one-on-one every week. We had community activities, as you can see in this photo. We ended up needing to do everything online. We assessed how much money we were going to need to spend on housing and food and helping students to pay bills. That was a smaller part of our organization before the COVID crisis. We began the first of our campaigns to raise $200,000 for the first 100 days of the crisis. That was largely focused on food insecurity. We added extra coaching sessions to help students manage the loss of what was perhaps the most stable period in their lives, particularly related to housing. Next, we had to hustle, and I mean hustle in terms of moving fast. We thought we were working hard before, but what these students needed became unprecedented. Jobs and internship offers have been rescinded. Student housing at many of the colleges ended at the end of the semester. And now we need to raise our next $200,000 to help them pay rent. And in the fall, we have 12 scholars who will be graduating in the next couple of weeks. While we usually take new students in the fall, now we're going to commit to help those that are graduating who don't have jobs so that we can help them be settled before they move on and become Wiley alumni. What can you do? Well, of course, like everybody else that's speaking tonight, we would love for you to donate. Another thing you could do is to volunteer to become part of our career conversations. We're working with students to go over their resumes, to talk to them about what kind of jobs they might apply for, what kind of graduate schools they might want to go to, help them to get a little more focused. And if by any miracle you have a paid job or internship, we would love to hear from you. Also, do you know a landlord in Boston or somebody who owns a hotel? we could really use the access to free housing where students can have their own room and bathroom. Last Thursday, we had a student who had left school, gone to live with somebody in a fairly unsafe and unstable house, call us and say she had to be out of that house in 24 hours. So we put her up in a hotel, and fortunately we were able to get her settled in housing. But that's the kind of thing that we are jumping to every minute. It's different. So that's it for me. That's Wiley, and we would love to hear from you.
Sarah Rosenkrantz, the co-founder of Y2Y.
Yes, hello. Thank you so much for having me, TPC. It's great to be here. So Y2Y is in normal times, a student-run homeless shelter for youth and young adults ages 18 to 24. We operate in 2 seasons, October through April, and then again in the summer, serving young people who are aging out of foster care, who are leaving unsafe homes, who are coming out to their parents as LGBTQ and being kicked out. And we are one of only a few programs in Greater Boston that serve young people experiencing homelessness. So when COVID hit for us, the big moment was when Harvard said that they were sending their students home, which happened in the middle of March, around March, I think it was March 13th, we got the email. And all of a sudden it meant for us that the 200 student volunteers who run the shelter would be gone within a few days. And especially back in March when it was very, very cold, when many other programs were shutting down, we realized that it was just an imperative to stay open as long as possible. So we quickly scrambled and quickly pivoted the model. We were able to work with about 10 students who were either local to Cambridge or who were able to secure housing with the alumni or in other ways to keep the shelter open. And for a while, we were taking it week by week. So we wanted to get through spring break, and then we wanted to get through the first week of April. We wanted to get through April 15th, our normal season. And I'm happy to say that we are still open and still serving about 22 young people every night, making sure that they have a safe place to sleep during this pandemic. For a while, the whole shelter community, the whole shelter system was scrambling to figure out how to create a safe space for people when social distancing isn't possible in your own home and certainly isn't possible in a congregate setting. But in a lot of ways, we were lucky because the space that we had built was built with social distancing in mind, so that everyone has their own bed pod so that you're able to have private spaces. So now, like I said, we are still open. We hired a team of full-time professional staff to work in the shelter. A combination of those staff, of myself, of our other network staff, are going in to make sure that we can continue to keep young people safe. For young people, this is the only place that they have to go right now. Many of our daytime partners are closed. Most shelters are at capacity and turning people away. And so it's remained really important that we can continue to serve young people with meals, with case management, and of course with a safe place to sleep. We anticipate staying open through this pandemic as long as possible. We've been very lucky to get support from the City of Cambridge to do so. Our operating costs have skyrocketed, going from a volunteer model to a professional staff model with professional cleaning crew, with food that is bought and not donated. But we are hopeful that we will make it through the summer and then be able to reassess in the fall. So how you can help, unfortunately right now we are not taking volunteers, whereas normally we had 10 to 15 people in the space at every given time. We are now working with only 2 staff members in the space to minimize exposure. We're not taking donated food unless it is closed and sealed. So really what we need at this time is money to make it through this pivot to the professional staff. But we hear from young people that us being open has literally kept them alive and has kept them safe and healthy through this time. So we're so grateful for the support of so many people across the community that have worked to keep Y2Y open. That's us.
Okay. Thank you, Sarah. Our next presenter is Deanne DuPont, who's the Executive Director of FoodLink.
Hi, thank you for having us here tonight. What FoodLink does is we are what's called a food rescue organization. We provide fresh, nutritious food to organizations serving people in need, and we source that food through food donations from places like Whole Foods, Trader Joe's, Wegmans, and Panera. At least that's what we do during normal times, but of course this is not quite normal times. As to how we're doing, overall FoodLink staff and volunteers are doing well. We're volunteer driven. We have 5 staff and 250 volunteers. We're working twice as hard though, and it is good to be helping people. We've changed how we work in order to keep everyone safe by using social distancing, cleaning several times a day our operations center, and splitting everyone into teams whereby they volunteer or work on certain days of the week. And we do not cross the line as far as who is working with whom, so that if one person gets sick on a team, we don't bring the whole operations down. Literally overnight, just as these other organizations have had to do, we changed our operations and how we work. We've doubled the amount of food we're collecting and distributing. Previously, we focused on grocers and bakeries, but now a significant amount of food surplus or donations are coming from warehouses. We've added several new agencies and communities to our service area, including Chelsea and Lynn. We also added St. Paul's Food Pantry in Harvard Square. That connection came through one of your members, Tara Laureate, who learned about FoodLink at one of your education sessions, and she reached out to us when St. Paul needed additional food. You may have seen or heard of the breakdowns in the food supply chain, and we are working diligently to try to access some of that food before it's discarded. In April, we estimate we distributed well over 100,000 pounds of nutritious food, which is enough for over 80,000 meals. We've done this through trucking and transportation partnerships with the Boston area Gleaners and Intelligent Labor and Moving. These numbers came out today, and the slide we had to get that up yesterday, so that's why some of these numbers have changed a bit. How are clients affected? Many of our programs that we serve are suspended, such as working with children's programs, but those have been replaced by mutual aid groups, pop-up pantries, and established pantries and food programs that cannot obtain access to enough food to meet their needs. After we deliver food to an organization, say a food pantry, along with deliveries from other organizations such as the Greater Boston Food Bank, we all believe that that pantry is set up with an abundance of food. Then we hear stories or see pictures whereby people are in lines blocks long and the pantry runs out of food before everyone is served. Even though we have doubled the amount of food we are providing, we do not have enough to meet the need. And we have a waiting list of groups that would like to receive food from FoodLink. We're piloting a program whereby we begin to purchase food at wholesale and give it to some of these organizations. Some additional of what we're doing. One of the problems that we have is sufficient cold storage. That will be solved when we move into our new facility in December, which will have ample cold storage. But in the past week, we've worked out an arrangement with a local university to be able to utilize their cold storage in one of their closed cafeterias. This will assist us by providing the capacity to accept more perishable foods and distribute it when the agencies that need it or need it for their next distribution will be able to save it for them. And where do we need help or how you can help? Well, something that's in hard, is the supply that's hard to access is disinfecting wipes. We clean our facility several times a day, again at night. So if you have access to disinfecting wipes, also gift cards to office supply stores like Staples, because we are going through a lot of supplies. Also, sturdy canopies. One of the things we've been doing to exercise social distancing is popping up canopies outside in the parking lot to sort food. If you know of a refrigerated truck or a van available, or if you know of any warehouses, farms, large distributors that have food, even if they're out of state, we have ability to bring that food here. When we in June, we'll be launching our capital campaign, the public face of it. And once that's finalized, we would like assistance in publicizing and promoting that. And lastly, funding for both operations and the capital campaign. So
Great.
thank you for this
Thank you,
opportunity.
Deanne. Thank you very much, Deanne.
You're welcome.
Our next speaker is Janet Sekel-Sarati from Friendship Works. And we need to unmute. There we go.
Hi, for those of you who may not know about Friendship Works and are new to TPC, I just want to tell you that Friendship Works' enduring mission is to reduce social isolation, improve quality of life, and to maintain the dignity of older adults in greater Boston area. So this whole COVID-19 pandemic, where we're asking people to physically isolate themselves, has been an irony on our mission. But our mission continues and is even more important now than ever in making sure that there is social connection for older adults who can't get out, who may have been socially isolated prior to the pandemic or have become so because of it. And whether they're socially isolated or lonely, what we do is to match volunteers with an elder for friendship, for support, to take them to a medical appointment, to bring music into their lives, to do pet visitation in Spanish and English. And as the picture here shows, the kind of joy that happens when somebody who was alone has company now to help with them. We're actually doing okay. We're doing actually quite fine because we're really needing to step up to the plate. We started out during this pandemic of reaching out to all of our volunteers, over 400 of them, and to over, almost 2,000 elders who we touched the lives of in whatever way that we could to make sure they were okay, but then to continue to socially connect with them. We definitely, our priority is always in-home, face-to-face, hold your hand, give a hug kind of relationships, but we have pivoted to making old-fashioned telephone calls, doing video things where somebody has an internet, and I'd say about 80% of the elders that we serve, because they're low and moderate income, do not have internet access, and we're working on that and trying to get tablets and how to get internet to some people, because that enriches their life. But otherwise, it's through phone calls, through cards that we're having young people and old people make that are just bringing joy to people and making sure that if there are any issues there, that we can do some problem solving. Just give you an example of somebody that for one of the elders that we've had matched with a volunteer for a long time, that in addition to the volunteers' visits, face-to-face in-home visits and phone calls during the week before the pandemic, the television was probably the only other contact that this elder had, and to take his mind off of some of the hard realities of his life. And in the crisis, the television, as we know, television or YouTube or whatever can really be helpful, but his TV went on the fritz right at the beginning of the pandemic. And the volunteer, using a mask, glove, and social distancing, came in and fixed his television so he wouldn't be isolated from that. And the older senior is low income, couldn't afford to have anyone fix it, and really didn't know anybody else but Friendship Works and his volunteer. And he had also had some strokes and was unable to read a lot, so the TV was really important. So phone calls are still being made from the volunteer with the older adult. They have a wonderful, loving relationship, but it was also only that person who would have known that this had happened and been able to help. Our communities, we are getting more referrals than ever. We've opened up our work to getting referrals from throughout the city, from people who never had been there. We expanded our services, expanded our reach. We're still vetting all of our volunteers, trying to make really good matches so that they have interests in common, so they're not just talking about the pandemic, but if they love baseball, they're talking about that. If they love the arts, if they love TV, and hopefully after the pandemic, then they will be able to visit in person. How you can help? Well, Giving Tuesday is coming up, so we do have a site there, and please give to Giving Tuesday, and your gifts will be doubled on that day. And also, this will be our 5th year that we have a walk to end elder isolation. We are going to do it. It's going to be a virtual walk, though, this year on Sunday, May 17th, Sunday after next. And there's a TPC team, which has been created by one of your wonderful members. And you can join that TPC team and donate or join us on the 17th at 10 o'clock and be with us. But your support, your financial support, will help us to continue to provide services to older adults. And also, if you'd like to volunteer, please go onto our website. I think it's listed here, but
Yeah.
you can just look up Friendship Works and you can find it. So thank you.
Great. Thank you, Janet. And again, we'll be sending links and contacts for everybody on our list for the call. So our next panelist is Jessie Cass, the Executive Director of the Cambridge Women's Center. Jessie.
Thank you guys all for being here tonight and taking the time to learn about what's going on in the community. We sort of pull together people experiencing homelessness, people experiencing food insecurity and social isolation, and really appreciate the work of everyone who's spoken before me and who will after. So normally we are a drop-in space for people who are women from all backgrounds. We have people experiencing homelessness, who've survived trauma, experiencing social isolation, and they come in and get access to our 4-story home in Cambridge. And then we also have a helpline and support groups and workshops normally. We pivoted really quickly once we realized that we couldn't keep our day program open because we're 2 paid staff and volunteer based. And we couldn't keep people physically distant within our small space. So we had to close the drop-in in March. And within a week, I had trained 46 new volunteers. I started the process to train. It took a few weeks, but within a week, we started getting things up and running for an expanded helpline, offering expanded hours. And we opened up the helpline to all genders. And so what we've been doing, in addition to offering emotional support to anyone who calls, is there's a line for resource referrals, and we will take down tickets and then do the research. We have a team of volunteers who will find the best appropriate resource for that person. So we've gotten people grocery support or printed a document or helped them find a LGBT support group or access to a shelter. And then we also have moved our online support groups and workshops online, and that has allowed us to have more people than we usually can have in the space. So our yoga classes are capped at 5 usually based on space requirements, and we've had 10 to 18 in some of our classes. So some silver linings amongst it. But we are seeing and hearing about so much pain in the community. Our members are in contact with me personally on a regular basis. The ones who are experiencing homelessness are not able to access shelters. The shelters are cutting down numbers of people that they're accepting. The people who are unhoused and sleeping on the streets, there's only recently, this last weekend, did the city add 2 more porta potties, and before that there was only 2 toilets in all of Cambridge for over 200 unhoused people who can't get shelter right now. So things are really tough, and we're doing the best that we can to. We've always been a place that fills in the gaps, and now we're just trying to fill in those gaps, and they're even further. They're big craters. And I think the biggest thing is that we just have a really powerful support network. So our members, I remember a couple of days after, one of my members calling me and saying, "Jessie, are you okay? Are you healthy?" And I was like, "Yeah, I'm okay. Can I get you some food? What do you need? Where are you right now? Do you have housing?" And trying to figure out how to fill in those gaps. So we were, with the TPC money, still able to hire our 3rd full-time staff. And so we just sent her an offer letter, and we're looking to figure out how we can reopen on a temporary and slow basis to try to figure out how best to serve our community. Unfortunately, like everyone, financial donations right now are the biggest need, especially since we unfortunately had a break-in at the center and the intruders stole several $1,000 worth of material goods, and we don't have a security system, so we will need a security system. So we're looking into that, but any donations, even $5 really helps. And my time is up, but I hope I will talk to some of you soon, and please feel free to reach out to me.
Okay, thank you very much, Jessie. Next, we have Lisa Funero of the Massachusetts Adoption Resource Exchange.
Hi, thank you. Thank you very much for having me here. Thank you to all the TPC folks and to all the guests. MARE recruits adoptive families for kids in foster care. There are our kids. They're all in the custody of DCF. And as you can imagine, when the pandemic started, everything stalled. We help families and kids get matched together. Families stopped getting trained, stopped getting home studies, which is the approval process. We weren't able to have our events where we bring social workers and kids and families together to informally meet. And for our kids who on any given day are invisible, this pandemic just made them more so. One of our biggest fears is that the number of kids coming into care will significantly increase because of the lack of attention, not being in schools, that these kids will be experiencing. So what have we done to change what we're doing and to try to reach the demands to try to have kids and families meet and potentially get matched? Because these kids need to know that we're out there still trying to find families for them. Well, we've reached out directly to families and have tried to support particularly those who have kids that have just moved into their homes. Our kids need a lot of structure, and there is no structure right now without school in place. We've asked our families, we haven't been able to go and do videos of our kids, which are an extremely effective way that we match kids and families. So what we did was we've asked families to create 1 minute videos, which we're able to then show to social workers. So we've flipped the script in order to meet what we can do. We also have started to do virtual matching events, which have been quite a very well-received process. We've brought social workers who have kids into break rooms with social workers who have families. And it's really been very successful, and it's really cut across geographic boundaries that we've heard about. So what could folks do to help? Of course, we need financial support. Our biggest fundraiser is our Walk Run for Adoption, which is also on May 17th. We'd love to have TPC create a team. You can always go on to our Walk website and join Lisa's team. And most of all, just be aware, excuse me, of how vulnerable these children are, and to speak up for them. Thank you.
Thank you, Lisa. Okay, our next, let's see. There we go. So our next guest is Jose Palma. There he is. The Community and Legal Partnerships Coordinator for Justice at Work.
Yeah, thank you, Barbara, and thanks everyone for joining the call. Yes, my name is Jose Palma. I'm the Community and Legal Partnership Coordinator at Justice at Work, a legal nonprofit organization that provide legal support to worker centers and the workers. So many of the workers we support are vulnerable and workers that work in low-paying jobs. They always struggle, but during COVID-19, there are a few things we have identified that are kind of like the major issues happening right now. One is workers who qualify for unemployment insurance, but they haven't done it before, or they just don't know how to do it. And then we also have another group of workers who actually, because of the document of the immigration status, they don't qualify for any unemployment insurance or any economic support that has come across from different sources, including the federal government. And then we have workers who, because they work in places considered necessary nowadays, they have been pretty much going to work. But then when they have identified the place being unhealthy, they have started organizing in order to get some changes. So as a legal support, we have been supporting this worker to really advocate for healthy work environments. And then also trying to make sure workers get the support with the new laws that are getting passed and the protections that actually workers have the right to. So there are many stories I can share with you that we have seen during this COVID-19 situation, but one of the very common is, for example, a worker in New Bedford, a woman who was working in a fish house in New Bedford. When the schools were closed, she didn't have no one to take care of her kids, but she was told that if she stopped working, she's not gonna get paid. So in one of those situations that is very difficult to do. But working with our partners and providing her a legal support, we were able to actually convince the employer that actually this woman has the right to be protected and also get paid through the new law that was passed, the Family First Coronavirus Response Act, or as we are calling FICRA. So that's the type of issues that many workers are facing right now, that even though there are some laws that may provide some protections, they just don't know, the employer don't know, and there is a lot of difficulties that workers are facing right now. So that's just to probably to share one of the examples. As many of you know, we support many undocumented workers who are actually at this moment getting hit very hard because they don't qualify for federal support or for unemployment insurance. So therefore, there are so many other needs that they are facing at this specific moments. So there are many actions that actually you all can support with, and one is supporting the Undocu Fund, which is a fund that is getting organized and administered for some of our partners. There is also some other legislation that are getting moved here in Massachusetts that you can definitely support. And then you can also support Justice at Work for us to be able to continue doing our work as we continue helping workers to understand the new laws and also probably some new laws that will come very soon. So thank you for the support already, and thank you for partnering with us to make sure our workers, they get what they need and they deserve at this moment of emergency. Thank you very much.
Thank you, Jose. Our next speaker will be Veronica Serrato of Project Citizenship. Okay, wait.
How many times have we said unmute since this happened? Apologies. Thank you, Barbara, and thank you, the Philanthropy Connection, for your support. I love the fact that you're so engaged and committed to learning about the important issues that are affecting our communities right now. Our mission is to ensure that all immigrants understand and have access to citizenship. We serve Greater Boston as well as linguistically and geographically isolated communities throughout Massachusetts, including many, many economically disadvantaged zip codes. All of our services are free. As you may know, citizenship is the only protection against deportation, but it's also the best way to secure many important rights and privileges like access to a US passport, the right to vote, and most recently, access to the payroll protection program, which was restricted to US citizens as part of the CARES Act. But only 10% of eligible immigrants apply for citizenship because of the many obstacles on the path. The requirement that you know English, that you take a civics test and you pass a reading and writing test as well as a federal background check and endure a significant bureaucratic and long process. But we believe that citizenship is not only for the economically and privileged immigrants. 73% of our clients are living in poverty, 13% are unable to speak English because of a disability, and 10% of our clients are elderly and relying on an exemption for the language requirement. Despite all of these challenges, we have a 95% success rate. And what we have found during this COVID crisis, as the other panelists have said, is our clients are poorly paid, they rely on public transportation, they're either essential workers or they've been laid off. They're not working remotely. They are home health aides, custodial staff, personal care assistants, Uber drivers, and they're living in high-density, multi-generational homes, which makes socially distancing impossible. They also lack technology and internet access, and in all of these ways, they're more vulnerable than the general population. We are fortunate to have been able to transfer our phones to our cell phones and have a cloud-based office environment so we can all work remotely, but our clients lack Zoom accounts, they lack technology, and have not functioned well in this virtual environment. The virus has underscored and exacerbated the underlying disparities experienced by our clients who are Asian, Black, and Brown immigrants. We rely on 1,000 volunteers, but we're not able to do our workshops in our traditional way and have had to move to a virtual model where staff are filling out 20-page applications on the phone with clients, which you can imagine is painfully inefficient and can be really difficult. But we know that citizenship is critical during this time because it will ensure upward mobility. Citizens endured the last recession in a much better way than non-US citizens. Immigration status shouldn't affect one's health care, but we're seeing now that it does, and that citizenship is actually one of the social determinants of health. So since our office was last operational on March 13th, we've advocated for 276 clients who are approved for citizenship but have had their oath ceremonies canceled. They're among the thousands of US citizens, thousands of immigrants waiting for their oath ceremony so that they can become US citizens. And that includes one gentleman who's 74 years old and has COVID and is very concerned that he be sworn in as quickly as possible. We have 37 clients waiting for fingerprinting, 102 clients waiting for their interviews, and 98 new clients have contacted us since March 13th wanting to start their citizenship process. And that's because citizenship is the American dream and it's the ultimate goal for so many immigrants. The entire citizenship process is on hold now until at least June 4th. And although the government is continuing to issue denials and requests for evidence, there has been no virtual option, no remote option so that immigrants can be sworn in and continue on their paths to citizenship. We're anticipating an ever greater backlog when the government does reopen, and that we worry that the government will fail to implement safeguards and protections when it does reopen. We've seen time and time and again that the government takes any excuse to impede the government process, the immigration process, to close the border, to issue a travel ban, or to end issuance of green cards. So how you can help is to encourage all green card holders to call us now and apply for citizenship, to donate, obviously, sign up for our newsletter for future volunteer experience opportunities. We are going to need masks and sanitizers when we reopen. And if it's okay to say, we're on the upcoming ballot with TPC and we'd love for you to vote. Thank you so much.
Okay, it's time for our question and answer. So give us 1 second while we get all our panelists live again. And if you have any more questions, please type them in the Q&A. Let's see. Bridget, have we got everybody back? I don't see everybody yet. All right. Well, let's see. All right. We'll see how this goes. I hope all of the panelists can see the raise your hand option so that I know you want to answer. Bridget will try and help you if you don't see it right now. The first question, a number of you talked about access to technology or lack of, which is pretty shocking. And I'm wondering, is the city or the state doing anything to increase internet access? And are you doing anything in particular, accepting donations of used equipment, or how are you getting technology? Some of you mentioned getting technology into the hands of your populations that you're serving. There, okay, now I can see everybody. Anyone want to take that one? Janet.
I'll just say that I think this is hitting every population, and I think it's waking the people up who didn't realize that how many people in our country don't have internet access. So there's one thing about having the tablets or the iPads or having a smartphone. First of all, those things cost a lot of money. So it's not really age related, mostly it's income related. And then it's also, you have to have an account, you know, so there's like, you know, giving your name and having an account for an internet, and then some buildings aren't even Wi-Fi available. So in some rural areas in this country, it's even, you know, much worse than here in Boston. There literally is no Wi-Fi. It's something that, you know, for any of us in this country, we need to advocate for. This is just waking up. It's such a disparity between people who have it. You can't even apply for unemployment almost if you don't have internet access, because nothing's being done in person. For older adults, you know, they're really, who can't get out, they're really shut out because they have the phone. I mean, it's pretty basic. It's going back many, you know, that's how we used to live, but we didn't have times when nobody could come and visit with you before. So it's really increasing the isolation. It's changing the education of young people who can't, you know, do their homework, and, you know, classes are online, but if people don't have classes. So yes, there are some, I think the city's trying, and, you know, I know we have got some tablets donated to us with some hotspots for a few months, but those hotspots are going to disappear very short. You know, it's a donation for 2 months of hotspots, and then how do people, you know, keep their own accounts, pay for them, and so forth. So this is something that is a necessity in today's day and age, and I think we all need to advocate for it, and other people can add to that, I think.
Okay, anyone else want to add to that? Okay. I have a question for Wiley and Y2Y. What are you planning to do if schools don't open in the fall?
A great question. So we have, with our board and all of our staff, developed a kind of a series of contingency plans. So even without students right now, we are operational, again, with kind of extra support from the city of Cambridge. Right now, we are contingency planning to say, you know, how can we stay open between now and October 15th, which is our normal season when students come back, and then between now and January, which is when we think realistically students might be on campus. You know, Harvard right now has said that there will be school, and isn't saying until July whether it's virtual or in person, but we are kind of working on those contingency plans to see about a professional staffing model to keep young people sheltered.
Judy, did you want to comment?
So we have been talking to higher ed administrators from a variety of colleges to see if we can come up with a way to find housing all in one building for all of our students that are not able to find other housing, and to bring back the students that left college and are in unsafe and unstable situations. So we're working on that now. Remote learning is hard for everybody, it is almost impossible for the young people that we work with. So we're encouraging them to take incompletes if they need to. The colleges are working with us, and then hopefully over the summer they can make that up. And finally, we will be going into campaign number 3 at the end of August, because if we have to go another 3 months, we'll need to raise another $200,000. We're going to be almost increasing our budget by 50%.
I had another question asking if Project Citizenship and Justice at Work, if you work together in any way, and are there any synergies between you? And I guess I'll add a question: is there any hope for getting these people sworn in remotely?
So I'll start with the last question. So the government has issued guidelines that if we can prove there's an emergency or exigent circumstances, we can ask for some individual swearing in process, which is normally a public ceremony. So we're going through all of our clients who are waiting for a ceremony now to see if they would qualify. And the gentleman I referred to who's elderly and has COVID is a good example of someone who might be successful. But there are thousands of people waiting nationally, and I just saw headlines that there's a public oath ceremony planned in one of the states that have reopened. So unfortunately, Massachusetts, New York residents are going to be harder hit. Jose can answer this as well. You know, there's only one path to citizenship, and that's for green card holders. And I suspect that not a lot of Jose's clients are green card holders. So though we do work together, we can refer people back and forth. I don't know that we have the same client
population. Yeah. How about Jose?
Yeah, in our case, I think we actually, thank you to TPC, we have been using a lot the Zoom account lately, and we have been implementing, like including keeping the Know Your Right clinics that we do once a month. We just moved into do it by Zoom. And then we continue supporting, even though courts are pretty much almost closed for new cases, we continue working very closely with the Attorney General and the Department of Labor to make sure workers get the support they need and the protection they need right now. But we are working from home, like the majority of us, but we continue working very directly, including using Zoom as the tool to, to get connected to workers at this moment.
Okay. Hang on one second. A question for FoodLink. How is the state supporting citizens that need food, if they are?
At this point, I'm not aware of how the state is helping citizens. There may be programs out there. I'm just not aware of them. As far as FoodLink, oh, go ahead, Jesse.
Sorry. So there are multiple programs within the state and the city that are delivering groceries to senior citizens, that are working to create resource lists and compile them. The city of Cambridge worked with restaurants and paid restaurants to create packaged meals to give out to folks. So there's a lot of different things depending on the city. Obviously, cities with higher tax paying are doing more, but there's also a lot of at-risk folks in those communities. But it sort of depends on the area.
Right. Yeah. Right. The cities and towns are doing things. Absolutely. We see that and delivering meals and that sort of thing. But I'm not sure what the state is doing specifically. Jesse, do you know the state mandated programs?
The state has provided guidance and funds and an ability to reach out to them and let them know what they're doing. So they've been coordinating like a spreadsheet document and things like that. So less financial support and more coordination.
Got it. And then we do know that a lot of the state funding, at least for Eastern Massachusetts, goes through the Greater Boston Food Bank as well. I don't know if they received any specific funding during the crisis at this point. We did a program funded by the state, did reach out to us to talk about our needs and what we're doing and that sort of thing. With the idea of this group going to the state and asking for funds to help support groups like us so we can get food out to the citizens where they are helping.
Okay.
They help.
So this is another question in general to really all of you. There have been a number of federal programs to support nonprofits. Have any of you been able to tap into any of those programs? And what was your experience doing that? Has it been, we'll start in the, Veronica, do you want to start?
Yeah, so we did apply for the payroll protection program, and the first round, the money ran out before they even got to review our application. But in the second round, we found out Friday night that we had been approved.
Good. And Lisa, you had your hand up.
Yes, we applied during the first round, and we were very, very lucky to get funded on the first round. And it was one of the most nerve-wracking processes I've ever been through.
Yeah, we were as well. The first round, I think for us, the biggest challenge was not necessarily the application, but finding a bank that would submit it on our
Yes,
behalf, which ended up being a lot more challenging than we anticipated. So we were scrambling the last day to find a bank to do it.
Wow. What you wouldn't have thought. Janet?
Yeah, we didn't get it in the first round, although we applied through one of the big banks, Santander, nothing. They didn't even open their doors till 3 days before it was closed. But that's the bank we had to go through. I tried 3 smaller banks because they said, we didn't have our account there, so we couldn't. In the second round, I went back to some smaller banks who were overwhelmed and they couldn't do it. And then I finally, through somebody that I knew, got information about a bank in North Carolina. Applied to, so you're allowed to apply to one other group, and then we got it Friday night. And I have to tell you, May 1st was one of the best days in a long time. It was exhausting, but it was crazy. And when you find out, like the money really went to places that weren't needed in the first round. So it was really very upsetting knowing who got it and who didn't.
Well,
and
good for you for your resourcefulness to get to go for it there. Jesse, did you have a comment too, or?
Oh, I was just going to say, we happen to have been banking with Cambridge Savings Bank for years. So our board member applied through them, and we were really lucky to get in the second round, which luckily we operate on a small bank.
Okay. Yeah. Well, we're coming up on 8 o'clock. So I just want to say the work you're doing is absolutely amazing. And we're just all so impressed, and we're doing what we can to try and help you. And so from here, we're going to send all of our attendees the links to your donation pages, the links to your website, the links to TPC teams that have signed up for some of the virtual walks. And so just what can I say, but thank you all so much for everything you're doing. And let's all hope we can get out of this sooner rather than later. So.
Thank you.
Thank you.
Thank you.
Bye. Good night.
Good night.